Knock, knock. Hi, how are you doing today? My name's Courtney. I'm your nurse, cleaning my hands, providing privacy, verifying orders. So the provider has put in an order for us to do a urinary catheter on you, so I'm going to go ahead and get that procedure taken care of today, okay? So essentially what it's going to do is it's just going to help that urine leave your bladder, okay? Do you have any allergies to betadine, latex, tape? No? Perfect. Now, I do know for real world situations that this isn't allowed to touch. It's just my area. I don't have enough space to be able to do all this stuff and not break sterile field. So now I'm putting on my gloves, which would not be touching the sterile field. One-inch borders. Okay. Putting this in the corner. Open this up, taking those out. For the mannequin that I purchased, our catheter doesn't work very well with it, so I had to tape the one that comes along with it to the tube to make sure that it would be able to go into the urethra, so it's longer than it's supposed to be. I'm dipping that into the lubricant. That's hanging out there in the lubricant. Put it in the box, and so he doesn't yell at me. Catheter's facing that way. So we're going to turn this way. Real world, that's not allowed to move, but I just wanted to slide that down a little bit since I didn't have this space before. All right. Placing my hands here. My hands are no longer allowed to move. Cleaning the labia furthest away from me. Closest to me. Down the middle. This can go. Okay. Now I'm taking my catheter. All right, ma'am, so you may feel some pressure and some slight discomfort. What I'm gonna have you do is bear down for me, okay? Inserting the catheter. I see urine. I'm going another 1 to 2 inches. Okay, 1 to 2 inches. Clamping down here. I'm inflating the balloon. Okay, now I'm done as far as sterile procedure goes. So I'm washing my hands. I'm putting on new gloves. Coming back. Now, we're going to anchor this to the patient's leg. There's going to be some slack here. It's not going to be tight, so it's not pulling. And we're going to attach the bag to the anchors at the bottom of the bed. All right, ma'am. You have a great day. New day. Hi, how are you doing today? Great. My name is Courtney. May I have your name and date of birth, please? Perfect. So I'm verifying orders again. The provider has put in an order for us to remove your catheter, okay? So what I'm going to do first is I'm going to put on gloves. Clean gloves, not sterile, because this is not a sterile procedure. Now I'm going to go and I'm going to empty the bag. But before I'm emptying the bag, I'm checking to see how much urine was in there. Make sure there is no abnormal colors. Make sure there's no abnormal smells. There's no blood in here. Great. So we're emptying that. I'm unanchoring this from the patient. We are deflating the balloon. Okay, ma'am, so you may feel some slight discomfort, but there shouldn't be any pain. So what I'm going to have you do is take a deep breath, and as you exhale, I'm going to pull the catheter out, okay? So take a deep breath, and exhale, and we're pulling that out. Great, and so now I'm checking the tip to make sure there is no bleeding on there, that there's no holes in there, that I'm not seeing anything abnormal, everything looks normal. So we are done with that. And what I would do next is I would provide perineal care for the patient, since there's probably urine and potentially lube or something else on that patient. So I'm doing that.